The cancer word, historically has been a very scary word. So the first thing is to hold on tight and to be optimistic and to get very engaged and educated about your cancer.
I encourage patients that are faced with a cancer diagnosis to do their homework. They need to learn about what resources are available.
I think that cancer patients should ask their oncologist as many questions as they can about all of their treatment, whether they're getting chemotherapy, radiation, surgery, clinical trials, whatever questions are keeping you up at night. Take your little notebook, write them down, and go in and ask your doctor to put your mind at ease.
It's my belief that a patient really needs to have a good relationship with their doctor and the healthcare team beyond the doctor.
I think some of the most important people for the clinical trials are the nurses or other people that are trained in research, and they have a lot of interaction with the patient. And sometimes it's easier for patients to talk to someone who's not a physician about their questions, their fears, or what's going on.
It's very important when patients are faced with a diagnosis of cancer that they have support. It's a difficult thing to face alone, and we certainly encourage them to bring a caregiver, somebody that's going to understand the treatment that the patient's going to have so that they can provide the best support to the cancer patient.
And it's not necessarily your significant other. Depends on your significant other, really. But your most obnoxious friend is really the best. The one that's not afraid to really be rude and just blurt out questions that you have. And you can just sit there politely and have the doctor still like you.
Often you don't hear what the physician is saying. Your brain, your computer is multitasking and it's dealing with the issue of cancer. I often ask people to put their hand right in front of their face, and that's what it's like to wake up every day and see cancer in front of your face. And sometimes it goes away, it moves to the side, but then it comes back again. And so because of this, you're not hearing and you're not seeing everything that your physician says. So it's very helpful to have a caregiver, a family member, a friend, come along with you in each instance or each visit to your oncologist. And oftentimes, that person will hear what you might not hear.
I was with Jack from the very beginning. All conversations were with all of us, which I think is really wonderful because with a diagnosis of some sort of cancer, you really need to have everybody around you. Not that I got everything, but I tried to write notes and check things out and try to be just there for support and an extra set of ears.
People can access information on clinical trials through a number of sources.
I think the best place for patients to go for really unbiased information about clinical trials is cancer.gov.
The National Cancer Institute provides information about cancer guidelines, cancer treatment, information about cancer prognosis. Also, it's a great opportunity for patients to research whether there are clinical trials available for them.
If a patient is really interested in being in a clinical trial, they can go to clinicaltrials.gov. It lists all the clinical trials have to be listed there. You can put in your cancer, you can put in where you live, you can put in all this information and see what's available.
They can call the American Cancer Society. We have a clinical trials tracking service and we can help them find places that provide clinical trials. I would refer people to our website, which is cancer.org.
The American Cancer Society's website provides an abundant amount of information about cancer diagnosis and treatment, side effects of treatment, issues like survivorship.
The ACT website can also provide a number of good, solid leads in terms of clinical trials.
On that website, learn about clinicaltrials.org. There's a very comprehensive list of resources for cancer patients.
We were wise enough to know that we had to have a laser focus and only look at information that was from a very reputable site.
Early on, understanding these things is going to go a long way in terms of helping have good conversations later on. Sometimes 2, 3, 4, 5 years later, you're going to be able to have better conversations because you had a good early conversation and learned about your disease.